Welcome to today's lecture. Today we'll be discussing pneumonia. Pneumonia. Today we'll be discussing pneumonia. Uh, we all have heard about pneumonia, and it's one of the common respiratory conditions. So today we're going to discuss pneumonia. So our objective discussion, our general objectives at the end of the lecture, students will be able to demonstrate knowledge of pneumonia and be able to provide nursing care to patients with pneumonia. Specific objectives at the end of the lecture. Uh, we're going to define pneumonia. We're going to state the classes of pneumonia. We're going to state the causes of pneumonia. We're going to state the predisposing factors of pneumonia. We're going to define bronchopneumonia. We're going to describe the management of pneumonia. We're going to define bronchopneumonia, describe the pathophysiology of bronchopneumonia. So to begin with, what is pneumonia? Pneumonia is inflammation of the lung tissue, the inflammation of the lung tissue characterized by cough, chest pain, dyspnea, and fever, usually due to bacteria, virus, or fungal infection. So pneumonia is the inflammation of the lung tissue characterized by cough, chest pain, dyspnea, fever, um, usually due to bacteria, virus, or fungal infection. So pneumonia is caused by bacteria infection, virus infection, and also fungal infection. So when a client has pneumonia, it presents with chest pain, it presents with dyspnea, and also it presents with fever. So a client will be complaining of what? Fever. And also dyspnea, you are going to see some difficulties in breathing, and also there will be chest pain. So this is the structure of the lung. So inflammation of the tissue of the lung is what pneumonia is. Inflammation of the tissue of the lung is what pneumonia is. This is the respiratory system, the primary bronchus, the secondary bronchus, the alveoli, the bronchi, the terminal bronchi. So we're going to look at all these in details on what happens to the structures of the lung, the tissue of the lung. Classification of pneumonia. As we said that we're going to look at the classification of pneumonia. So pneumonia is classified according to the cause and also the atomic structure affected. Atomic structure affected. So pneumonia is classified according to the causative organism, whether it's bacteria, fungal, or virus, or according to the atomic structures affected. So according to the atomic structures affected, we have bronchopneumonia. Bronchopneumonia involves the bronchi. So the bronchi, if the bronchi are affected, it's called bronchopneumonia. So if lobar pneumonia involves the lobes of the lungs. So if the lobes of the lungs are affected, it's called lobar pneumonia. According to the causes, we have aspiration pneumonia. Aspiration pneumonia comes due to inhalation of fluids, food or vomiters in the airway. So in a client inhales fluids, food or vomiters in the airway, they end up having aspirated pneumonia. Then this is according to the causes. If the client, we have also hypostatic pneumonia, which comes due to immobility. The client is not moving; it's just mobile today. Especially when the client is unconscious, they can end up having hypostatic pneumonia. We also have atypical pneumonia, atypical pneumonia, which is caused by less common organisms. That's the one I was talking about for virus, fungal, or bacteria. This is the respiratory tract. So this is a sign when the client has pneumonia. It speaks the inflammation of the lung tissue. So inflamed lung tissue is a sign when the client has a pneumonia. The trachea, this is the bronchi, this is the lungs. Causative organisms which causes pneumonia. So under bacteria, we have Haemophilus influenza, we have Streptococcus pneumoniae, These are some of the organisms which causes pneumonia under bacteria, the Streptococcus agaricus. Also, these are some of the causes under bacteria. Under virus, we have adenovirus and also influenza virus. They can cause pneumonia. We have also fungal. We have pneumonia cytis carina. They causes fungal pneumonia. We have also protozoa mycoplasmic pneumoniae. They can also cause pneumonia. Pneumococcus organism. So if you view the lungs under the microscope, you see the lung like this. This is how it presents, and the client has a pneumonia. Predisposing factors of pneumonia. So when somebody has a chronic bronchitis, it's a predisposing factors of pneumonia because it's inflammation of the bronchi, so it can cause pneumonia. And also, when somebody has viral infections such as measles, because it affects the respiratory tract, also reduces the immune system, so the client is predisposed to have pneumonia. When the client inhales foreign materials into the respiratory tract, as we mentioned that when aspiration under respiration amount, which later descends into the lower respiratory tract, causes pneumonia. So if somebody inhales any foreign substance in the respiratory, food, fluid, it can cause pneumonia. Obstruction of the respiratory tract by growth. So if you have any growth such as a cancer, which can lead to retention of fluids and secretions into the lung tissue, eventually becomes infection. So any obstruction to the respiratory tract by growth, any abdominal lesion, growth, a cancer, it can cause retention of fluids, which can also cause infection and lead to inflammation of the lungs, causing into pneumonia. And also prolonged exposure to cold. Prolonged exposure to cold. So it's important to keep warm. Prolonged exposure to cold, which can irritate the respiratory tract and also reduce the inability for cilia to expel the foreign bodies, including microorganisms. This raises the risk of microorganisms invading into the respiratory system. So we're going to look at bronchopneumonia. Bronchopneumonia, this is the inflammation of the lung occurring in the patches around the infected terminal bronchi. It may become confirmed to one segment of the lung, or it may be widespread to the whole lung or both lungs. Usually result as secondary infections such as measles, and also result in aspiration of oropharyngeal material into the air. So bronchopneumonia is the inflammation of the lung occurring in patches around the infected terminal bronchi. So there will be patches of inflammation. It may be confined to one segment of the lung, or it can spread to the whole part of the lung, or the both lungs can be affected. Usually result into a secondary infection from measles, and may also result from aspiration of oropharyngeal materials. The pathophysiology of bronchopneumonia. So the invasion of organism provoke an immune response in the lung. So after the organism has invaded the lung would respond. The immune system is going to respond. So the blood, small blood vessels, the capillaries they start leaking. They leak, and from protein fluids they seep into the alveoli. So after the organism has invaded the lung, the immune system will respond. The capillaries will leak, and protein-rich fluids will seep into the alveoli. This results into less functional area for oxygen because the alveoli are fluid, so they will result into less functional area of oxygen and carbon dioxide exchange in the alveoli. The patient related oxygen is deprived because the alveoli has fluid, so the exchange of oxygen will be deprived. while retaining potential damage to resulting to damaging carbon dioxide. Because the alveoli has fluid, so the exchange between oxygen and carbon dioxide will not occur. So a client will be deprived of oxygen. The patient's death and rate of breathing increases because the client has now started uh, fighting to get oxygen in an effort to bring in more oxygen and blow off more carbon dioxide. So the client will be panicking to breathe because of the fluids which are keeping the alveoli, uh, preventing the exchange of gases. So the mucus production is increased, and the leak of capillaries may time the mucus flood. The mucus flood decreases the efficiency of gas exchange in the lungs. So because of the mucus production is increased, and the leakage of capillaries may time into the mucus flood. So what usually happens, because the fluids have seeped into the alveoli has fluid, so it has affected the gaseous exchange which takes place in the alveoli. So they trying to start panicking for oxygen in the alveoli. So the alveoli will be filled with fluids and also white blood cells, which produce to fight infection. So there will be consolidation, a feature of bacterial pneumonia occurs when the alveoli, which is normally hollow space within the lungs, instead becoming solid due to confined fluid depression. So this is what usually happens when this is the alveoli. So when you have any infection, the fluid will seep into the alveoli. So when the fluid seep into the alveoli, the gaseous exchange will be limited. So the gaseous exchange will be limited. So the client will start now panicking to breathe. So that's what usually happens when somebody pneumonia. This is when somebody has pneumonia, this time that is affected with inflammation, and this one is normal. So here the gaseous exchange is going to take place properly, but here to be affected. So let's look at lobar pneumonia. This type of pneumonia is confined to one or two lobes of the lung. That's why the word lobar comes confined to one or two lobes of the lung. There's inflammation of the interstitium and intestinum, and the ovary does not contain stagnant fluid, but only protein-rich airway membrane. So this is lobar pneumonia. It's the normal lobe. This is the one which has pneumonia. When the organism reaches the lung, it will trigger an immune system, especially the neutrophils, which engulf the organism and release the cytokinase, which causes an inflammation reaction. The lungs become hypernemic, and the capillaries become highly permeable to fluids from the intravascular space into the tissue and the alveoli, which causes reduction in the exchange, thereby causing impaired ventilation. This causes congestion in the affected area, that the lung tissue and the alveoli. So the lung less expansion is called, the final stage is called congestion, because there will be congestion in the affected area. The lung appears laid and hard like the liver, hence it's called hyperhepatization, and is characterized by the presence of imprecise neutrophils in this stage. After all, there is hyperemia, which subsides and the lung remains hard but appears gray, hence it's called gray hepatization. In the stage of gray hepatization, the lung is gray-brown to yellow because of the fibrin, purulent exuent, and this degradation of red cells. The final stage is the dissolution stage, is characterized by the absorption and the restoration with the pulmonary architecture. Fibrinolysis inflammation may extend to and across the pleural space, causing the lab add uh, leading to resolution and also organization of the pleural radiation. So this is what usually happens in diagram of the lobar pneumonia. So the other side is normal, this side is affected. And this is how the lung looks like when if you're using a microscope. Signs and symptoms of pneumonia. So the first one is productive cough due to irritation and inflammatory process. So there's usually productive cough due to irritation and inflammatory processes. There's nasopharynx due to poor ventilation. Nasopharynx due to poor ventilation. There's also dyspnea due to poor ventilation as a result of inflammation in the lungs. There's cyanosis due to hypoxia. There's also chest pain. As I mentioned, chest pain in the introduction is one of the cardinal signs of pneumonia due to inflammation of the lungs, and there's fever due to infection. There's intercostal retraction due to impaired ventilation. There's vomiting of blood due to lapse of the blood vessels. There's nausea and vomiting due to the GIT involvement. There's headache due to cerebral hypoxia because there's reduction of oxygen to the cerebrium, so there will be headache due to cerebral hypoxia. There's also general body malaise due to tissue hypoxia. There's anorexia due to inflammatory process. There's joint pains due to tissue hypoxia. Then under diagnosis or investigations, history taking of the patient may review a stabbing chest pain made worse by deep breathing or cough. On palpation, there will be downers and also on the affected side due to consolidation of the underlying lung. When you do sputum focal microscopic examination to show the causative organism, especially when it's caused by bacteria, white blood cells, after you do a full blood count, you discover that the white blood cells will be elevated. When you do blood culture, you're going to see the causative organism. If you do a CT scan, you're going to see the affected part. Do chest X-ray, you're going to see all the patches which are affected by the disease. So this is how it presents on the X-ray. So if it's caused by bacteria, you give penicillin 1 to 4 mega units QID for 5 days. Then you can also give analgesics and palliatives for 3 days. You can also give oxygen therapy to counteract hypoxia. So you give, if it's in an adult, you give 2 to 5 liters a minute. You can give salbutamol if the breathing pattern is there's too much inflammation. If it's caused by fungal, you can give antifungal treatment such as fluconazole 100 milligrams PD for 7 to 14 days. Then you can also give, if it's broncho, you can give bronchodilators such as Ventolin 2 to 4 mega units TDS. And also you can you can put a patient on bed rest to promote quick recovery, and also balance that to boost the immune system and also promote quick recovery. Give a lot of fluid to prevent loss fluid. So these are some of the complications: empyema, septicemia, abscess, pleural effusion. These are complications associated with pneumonia. So we just